But time now for our positive Professor Karol Sikora, and with millions of folk all over the world now believing monkeypox is coming to infect them at almost any moment, the scaremongering over the previously little-known ailment just seems to be off the scale, really. The hysteria being spread by the health establishment, especially the World Health Organization, aided and abetted by the mainstream media, is gaslighting, in my opinion.
Experts are warning there is a risk that monkeypox could become endemic in Europe if the current outbreak isn't brought under control.
Monkeypox is continuing to spread, so we're going to be answering your questions.
Anyone who's been told by the health authorities that they've had high-risk contact with an infected person has to isolate for 21 days. That means anyone who's been a household contact, a sexual contact, or has even changed an infected person's bedding without appropriate protective gear.
The desire to make us scared by talking about an illness that has been around for decades and has no known treatments is part of the plan, I think, to keep us in a cycle of fear. Well, Karol Sikora was previously head of the cancer operation for the World Health Organization. He's here to provide his medical expertise with a much-needed dose of reason. So, Karol, does the monkeypox reaction show hysteria has almost become enshrined in the modern public health playbook post-COVID?
I'm afraid so, Dan. It really has. I'd not heard of monkeypox before. I've been a doctor for 50 years nearly. And obviously smallpox, cowpox, chickenpox, they're all related viruses, big viruses, totally different from corona. It's a sign of the times. We've seen restriction of people's freedom across the world, some countries really devastatingly bad. If it's in the name of public health, that's great if it's important. But the evidence base for a lot of those restrictions, whether it's lockdown, whether it's travel bans, whether it's filling ridiculously long forms in multiple languages to say where you're going to stay when you enter a country, whether it's doing PCR tests and so on, there was no evidence base for all that. And of course, if you take total health, which you have to in any healthcare system, whether it's the NHS here or other systems in Europe and other countries, it's got to be how you can actually help the most people of the population. And if you get distracted by this, monkeypox, 57 cases, maybe 62 now, who knows? No one's in hospital, no one's on a ventilator, people get better. Doesn't look good. You get scars, you've just seen the pictures. And I've seen you argue with some of your participants in your program. I've been away for 2 days working abroad, but I've seen them now. And there's no doubt this is hysteria. And it fills newspapers for inches,
I know, but Karol, we've got to step away from that because otherwise people are going to be living in constant terror. And I find it so disturbing that immediately, Karol, you've got organisations, you've got government saying, we will have a 21 legal mandatory lockdown period. We didn't ever have stuff like that before. Can't we all just take a breather?
I think so. Tomorrow I'm going to go on the train to London with an Ebola suit, those things with a helmet, and just go on the train and say, I'm scared of monkeypox to everybody and see the reaction. It's a complete overreaction to it. And of course, people with high visibility vests and clipboards are in their element with all this going on, directing people. I think we've got to get out of this. It's a reflection of the fear inspired by coronavirus. Something else comes along, we think it's going to be as bad. People do get it.
But this isn't even new, Karol. And there's a vaccine, there's treatment, and you've got Sly News sending alerts to my phone every day saying there were 7 new cases of monkeypox. Who cares? It's manipulation.
Exactly. I mean, if you take the diseases that are killing people in Britain, it's heart disease, cancer and stroke. These are the things we have to go for. A lot of it's preventable, and those that are not prevented, we can treat. But if you get deviated into corona or monkeypox now, you're going to spend a lot of effort, a lot of money, and a lot of professional time, doctors, nurses, healthcare workers around the place, deviating from what's really important in medicine. And people will suffer. So let's not do it. Let's keep righteous and on target for the total health of the population, not something that's an artifact of the media.
sage advice as ever from our very calm and considered positive Professor Karol Sikora. Thank you so much.